Most women know the stat of 1 in 8 will develop breast cancer. However, some, especially those that are younger, may not know what it means to go through the process of a mammogram, what it means to get called back, and what happens if they're diagnosed with breast cancer. All of it is understandably overwhelming.
We do mammograms every day. Patients really don't typically have a problem with it. It's really a pretty easy procedure. The positioning may seem a little bit awkward or not what you're used to, but they'll guide you through it and really try to make that experience as easy as possible for you.
We demonstrate the compression, the machine, the noises that they're going to hear. We do front images, we do side images, just to let them kind of get acclimated to the atmosphere that, we'll be working in. Most patients afterwards are, relieved and say, oh, that's not as bad as what my friend told me or my neighbor told me. So, they do quite well with it.
Across the world, there have been great advancements in breast cancer, both treatment and diagnosis. And just in the past 5 years, even the smallest spot in the breast, the size of a piece of sand, can be detected.
And that is true. So you find calcifications, for one thing, are very tiny, like grains of salt. So if you're not getting a mammogram early, you're going to not feel that or see that until it's a little more advanced. So we definitely want to catch the early cancers or any abnormal findings early before they develop to where you can feel them. So early detection is key with that.
Especially as we've had tomosynthesis, what we call that 3D mammogram, we see architectural distortion. This is something that we didn't usually see very often before, and now we see it pretty commonly. So that's really increased our callback rates, our numbers of patients that are getting called back for things that we're now seeing that we just haven't seen in the past.
For women who are getting a mammogram for the very first time, it is important to know that the initial exam will be used as a baseline for future mammograms. And if there are any differences from year to year, the patient may get called back for additional screening.
And we're going to want to know, is this something that's benign, meaning not cancer? Is it okay just for screening mammograms in the future? Is it probably benign, something that looks okay, but something that maybe we want to keep an eye on? Or is it something more suspicious? Is this something that we want to do a biopsy of to be definitive and really know for sure what's going on in that area?
Only about 0.005% of women who have a mammogram are diagnosed with breast cancer. If that unfortunate news happens, there will be a Deaconess nurse navigator assigned to the patient for every step of the way.
Share my phone number with them, because there's always, after that initial phone call, you're kind of shocked. So a lot of them, take a step back and then will call me the next day or later and say, okay, now I can talk. So, always want to make sure they're in a setting where they're comfortable to talk about their diagnosis.
They do an excellent job, and they're really able to relate to patients, and they're oftentimes the ones that patients remember and go back to with questions in the future. So they're an excellent resource for our patients.
If detected in the early stages, 99% of patients diagnosed with breast cancer survive.
The combination of catching something early and the state-of-the-art treatments that we have now really give patients their best chances. And we have so many patients that are coming in as cancer survivors. We see them every year just for their regular mammograms. And they've had a cancer diagnosis 20 plus years ago. It's not a death sentence. We know that patients are going to do well with this diagnosis in most cases.
My mother was a 48-year survivor, and so I try to share that with the patients. Not that every case is going to be, as that is, but they like hearing that too. It gives them hope, that, hey, I can fight this. So, and positivity, just them being positive through all this, It's a hard diagnosis, but women are tough and they usually do quite well with it.
To schedule a mammogram, please visit deaconess.com/mam. For Deaconess, I'm Lance Wilkerson.